I've come from the council.
Street by street, door to door. This is what it takes to contain an outbreak.
Because there's been a rise in this particular area, we've got a team of testers with us.
These are mainly unpaid volunteers working with the council in Oldham, Greater Manchester, an area turning the tide on rising COVID infection rates, while the rest of Manchester remains the current UK hotspot.
I think it's brilliant, and here it's fantastic. They come to your door, and yeah, I think it's brilliant. Should do this everywhere, really, shouldn't they?
There's doorstep testing here, but severe testing shortages elsewhere. Confusing local restrictions are having little effect, so Oldham is doing for itself what the government is struggling to, keeping people safe.
Central government needs to learn from us in local government about what we've been doing and what's been successful. They need to listen to us, and rather than doing broadcasts via Zoom where they tell us what the government is doing, which it's not always clear whether or not it's backed up by the science, that dialogue needs to be two-way. We need to be feeding back up into the government what we're doing on the ground, that's working, and then they need to learn from that and roll that out to other areas rather than imposing kind of top-down restrictions that are not always backed by the science and appear illegitimate to vast numbers of people.
Another aspect to why infection rates are spiralling so alarmingly up here in the north is that when the national lockdown was lifted during the summer, it was done on a London-centric basis, leaving infection rates still uncomfortably high in parts of the north. Well, social and economic inequalities have combined since then to do much of the rest. It's known as the North-South divide, higher levels of unemployment, overcrowding and poverty that are now contributing to rising hospital admissions too.
In the northwest region as a whole, again, the number of beds that are using ventilators, for example, they're filling quite rapidly. So at the start of the month, it was 15 ventilators being used in the northwest, and by the end of the month, it got up to about, I think it's about 100. So almost a factor of 10 increase.
And there are students, lots of them, back on campus since September, most now confined to cramped apartments and halls of residence. A predictable wave of student infections increased Manchester's overall rate tenfold. Some may be tempted to think this is all happening a long way from the capital, but as the government prepares to announce new lockdown rules that could be economically disastrous up here, the predictions are that London could be just 2 weeks behind. Jonah, Al Jazeera, Manchester.